You know your eye color. Brown, blue, green, hazel. You have known it your whole life. What you probably do not know is that your eye color is linked to your pain threshold, your alcohol metabolism, your statistical risk of 4 specific diseases, and according to data collected from over 10,000 people, your likelihood of winning a competitive sport. None of this is in your annual checkup. None of this was in school. And all of it is sitting right there on your face. So let's read it. Your biology teacher lied to you. Not on purpose, but still, you were told eye color is simple. Brown dominant, blue recessive, 2 blue-eyed parents, blue-eyed kid, clean. Logical. Wrong. Scientists now know that at least 16 genes are involved in deciding your eye color. 16, not 1. Think of it like a group chat where everyone is arguing about the final decision, and the result depends on who shouts loudest that day. The one thing all those genes are actually controlling is a single molecule, melanin, the same pigment that tans your skin. Your iris uses it like a dimmer switch. Lots of melanin, brown eyes, less melanin, green, almost none, blue. And here is the part that sounds like a glitch in the simulation. There is no blue pigment in a blue eye. 0. What you are seeing is light scattering through a nearly transparent iris. The exact same physics that makes the sky look blue. Your blue-eyed friend does not have blue eyes. They have eyes with almost no color at all. And your brain is filling in the rest. That one molecule, that dimmer switch, that is what everything else in this video connects back to. Because melanin does not just live in your eyes, it runs through your entire nervous system, and that changes everything. Here is something no doctor has ever told you before your surgery. In 2009, researchers at the University of Pittsburgh ran a study on post-surgical pain. They measured how much discomfort patients reported after the operation. They tracked how much anesthesia was needed to keep them under. And when they sorted the data, one variable kept jumping out. Not age, not weight, not fitness level. Eye color. Dark-eyed patients needed significantly less anesthesia to stay sedated. Light-eyed patients, particularly those with blue or gray eyes, required on average 20% more anesthetic to achieve the same effect. And after surgery, dark-eyed patients reported feeling pain more intensely, but recovered faster. Light-eyed patients reported lower initial pain, but needed more medication over time. Same operating table, same procedure. Completely different biological experience. So what is actually happening here? Remember that dimmer switch, melanin. It does not just determine what color light bounces off your iris. Melanin is chemically connected to the production of dopamine and endorphins, your brain's natural pain-killing system. More melanin means a more reactive pain signaling network. The alarm goes off louder, but the fire department also arrives faster. Less melanin. The alarm is quieter, but the system is also slower to respond, which is why light-eyed patients need more external chemical help to achieve the same sedation. Think of it like 2 different smoke detectors. One is ultra-sensitive. It screams at burnt toast. The other barely reacts to a small fire. Neither is broken. They are just calibrated differently from the factory. This finding was significant enough that some anesthesiologists now factor eye color into pre-surgical planning. Your eye color is not just on your face. It is in your medical file. Or at least, it probably should be. Here is a fact that will change how you look at every bar in the world. Multiple studies tracking alcohol consumption across thousands of participants found a consistent pattern. People with light eyes, blue, gray, green, drink more alcohol than people with dark eyes. Not slightly more, significantly more. A 2015 study published in the American Journal of Medical Genetics analyzed data from over 10,000 Americans and found that light-eyed individuals had statistically higher rates of alcohol dependency than their dark-eyed counterparts. For a long time, nobody could explain why. Then researchers started looking at the timing. Dark-eyed people feel the effects of alcohol faster. The room tilts sooner. The warmth hits quicker. Their body is essentially sending a stronger signal that says, that is enough. Light-eyed people process that same signal more slowly. The feedback loop is delayed, so by the time their brain registers that they are affected, they have already had more. Same drink, same body weight, different internal clock. And again, it comes back to melanin. The neural pathways that process alcohol's effect on the brain overlap significantly with the same dopamine circuits that melanin helps regulate. More melanin means a faster, louder chemical response. Less melanin means the system takes longer to register the input. Think of it like internet connection speed. Dark eyes are running on fiber. Light eyes are on a slightly slower connection. The data gets there eventually, but the delay changes behavior. And over thousands of drinking occasions across a lifetime, that delay adds up. This is not a moral judgment. It is a calibration fact. If you have light eyes and you drink, your body is genuinely less equipped to tell you when to stop. That is not weakness. That is wiring. Knowing your wiring is the first step to working with it instead of against it. Here is something blue-eyed people have been told their whole lives. You have such beautiful eyes. What nobody told them is that those beautiful eyes are quietly exhausting their brain every single day. Here is why. The amount of light that enters your eye is controlled by your pupil, but the amount of light your brain has to actively filter and process is controlled by your iris, specifically by how much melanin is in it. A dark iris acts like a natural polarizing filter. It absorbs excess light before it can flood the retina. A light iris, with less melanin, lets significantly more raw light through. And all of that extra light has to go somewhere. It goes straight to your visual cortex, which then has to work harder to process it. This is not discomfort. This is measurable neurological load. Studies show that people with light eyes are significantly more likely to suffer from chronic migraines triggered by light exposure. They are more sensitive to screen glare, bright offices, and overcast winter skies. And here is the part that connects to something much bigger. Light sensitivity is directly linked to the regulation of serotonin, your mood-stabilizing neurotransmitter. When your visual system is under constant low-grade stress from excess light, your serotonin regulation takes a hit. This is one of the biological mechanisms researchers point to when explaining why seasonal affective disorder, winter depression, is dramatically more common in Northern European populations. Populations that are historically and predominantly light-eyed. The short gray days of a Scandinavian winter are not just psychologically hard. For a light-eyed nervous system, they are a genuine physiological stressor. Think of it like a camera sensor that is set too high. A dark-eyed iris is a sensor calibrated for bright conditions. A light-eyed iris is a sensor that is permanently overexposed, constantly trying to compensate, constantly burning processing power just to see normally. The brain tax is real. It is invisible. And for light-eyed people, it is running in the background every single day. This is the part where things get uncomfortable, because up until now, everything we have talked about is clean biology, melanin levels, neural pathways, anesthesia dosages, hard data. But now we are stepping into territory that makes even serious researchers nervous, the link between eye color and personality. And before you roll your eyes, that is exactly the reaction the data does not support. A study published in Current Psychology in 2019 surveyed over 1,000 participants and found that dark-eyed individuals scored consistently higher on measures of agreeableness and empathy. A separate analysis of competitive athletes found that dark-eyed competitors performed significantly better in reactive sports. Boxing, tennis, cricket, sports where you respond to what your opponent does. Light-eyed athletes outperformed in self-paced sports. Golf, rowing, weightlifting, where the environment is controlled and the competition is internal. Same pattern we keep seeing. Dark eyes, faster reaction to external stimuli. Light eyes, better performance when the pace is self-directed. Then there is the trust data. And this one is genuinely strange. A Czech study asked participants to rate faces for trustworthiness. Dark-eyed faces were consistently rated as more trustworthy, but when researchers digitally swapped the eye colors, keeping everything else identical, the trustworthiness ratings followed the face shape, not the eye color, which means we are not actually reading eye color consciously. We are reading the facial features that tend to correlate with eye color. Our brains have built an unconscious shortcut, and it is running without our permission every time we meet someone new. Now here is the disclaimer that actually makes this more interesting, not less. Correlation is not causation. Your eye color did not program your personality, but the same genetic and neurological architecture that determined your melanin levels also shaped how your dopamine system fires, how quickly your nervous system responds to stimulation, and how your brain weights risk versus reward. Personality is downstream of neurology, and neurology is upstream of eye color. They share the same source code. Your eye color did not make you who you are, but it is written in the same language. Your eyes are not just sending signals to the world. They are sending signals about what is happening inside you. And some of those signals are early warnings that most people completely miss. People with blue or gray eyes have significantly higher rates of uveal melanoma, a rare but aggressive cancer of the eye itself. The mechanism is straightforward. Less melanin means less natural protection against UV radiation penetrating the iris. The same way pale skin burns faster than dark skin. A pale iris absorbs less and damages more. Ophthalmologists recommend that light-eyed individuals wear UV-blocking sunglasses year-round, not just at the beach, every day, because the exposure is cumulative and the damage is silent. Light eyes are also statistically linked to higher risk of age-related macular degeneration, the leading cause of vision loss in people over 50. Again, the culprit is UV penetration, less melanin, less natural filter, more long-term retinal damage from a lifetime of ordinary daylight. Now flip to dark eyes. Higher melanin concentration in the iris is associated with increased intraocular pressure, which is the primary risk factor for glaucoma. Dark-eyed individuals are statistically more likely to develop glaucoma and are often diagnosed later, because the increased pigmentation makes early structural changes harder to detect during routine eye exams. The protection that melanin offers against UV damage comes with a trade-off in fluid drainage mechanics inside the eye. Think of it like a building with thick walls, great insulation, but if the pipes start backing up, the problem is harder to spot from the outside. And then there is something that almost nobody talks about. Changes in your iris color over time can be an early indicator of systemic disease. Yellowing of the whites of your eyes signals liver stress. A white or gray arc appearing around the iris in people under 45, called corneal arcus, is associated with elevated cholesterol and cardiovascular risk. Kayser-Fleischer ring, a brownish deposit around the outer iris, is a classic diagnostic marker for Wilson's disease, a rare copper metabolism disorder. Your ophthalmologist is not just checking your vision. They are reading a biological dashboard that connects directly to your liver, your cardiovascular system, and your metabolic health. Most people see that dashboard once every few years and never think about it again. That is a mistake, so let's bring this back to you. You walked in here knowing your eye color. You are walking out knowing something different. You are walking out knowing that the melanin level in your iris is a thread that runs through your pain tolerance, your relationship with alcohol, your neurological load, your disease risk profile, and the unconscious judgments strangers are making about you before you open your mouth. That is not a small thing. So here is what you actually do with this information. Because information without application is just trivia. If you have light eyes, you are running a nervous system that is calibrated for sensitivity. Bright screens late at night are hitting you harder than you think. Your alcohol feedback loop is slower than average, and your UV exposure risk is real and cumulative. Blue light glasses are not a wellness trend for you. They are basic maintenance. Sunglasses with UV 400 protection are not optional. And if you drink, build in harder external rules because your internal signal is delayed. If you have dark eyes, your system is reactive and fast. That is an advantage in high-pressure environments. But your pain signaling network is louder, which means chronic stress hits your nervous system harder and faster than you might expect. And glaucoma screening needs to be on your radar earlier than the standard guidelines suggest. Ask your ophthalmologist specifically about intraocular pressure at your next visit. Do not wait for them to bring it up. Regardless of your eye color, get a proper ophthalmological exam at least once every 2 years, not a vision test, a full exam. Because that dashboard we talked about, the corneal arcus, the Kayser-Fleischer ring, the early retinal changes, none of that shows up in a standard prescription checkup. You have to ask for the full read. Your eyes have been broadcasting data your entire life. Most people never learn to read it. Now you do. Hit subscribe for your next dose of logic serum because your body has been keeping secrets from you for years. We are just getting started.